We're Air Ambulance Charity, Kent, Surrey, Sussex, your local air ambulance charity. We hope you never need us, but every year lots of people in our local area do. Serious emergencies can happen to anyone, anywhere. On the road, on the beach, even at your school. When the phone rings, we can get to anyone in under 30 minutes. We have 3 helicopters and 4 cars, all fitted with life-saving equipment and medicine to help save lives. We have 2 medical teams deployed at any one time. We can get to you fast. We bring expert doctors and paramedics on board, and we carry life-saving equipment straight to the scene. Our helicopters are like flying emergency rooms, just like you might see in a hospital. We have lots of advanced equipment, and our doctors and paramedics work very closely with land ambulances to make a bigger team of people helping to treat the patient. Each helicopter has a life-saving crew made up of 2 pilots, 1 paramedic and 1 doctor. When someone calls 999, we have a team of people who look at these calls called dispatchers, and they will decide if the air ambulance charity is needed. We only get called out to very serious emergencies. Our doctors are highly trained in giving emergency medicine and anaesthesia, and they can make a diagnosis to decide what's best when they're with the patient. Our paramedics are highly skilled and have at least 3 years' experience working in the ambulance service before they can work with us. Our pilots make sure we arrive at the scene as quickly and as safely as possible. They support the team and are very skilled in landing the helicopter in all areas.
Can you see him, Stu?
I can't see. Is he?
I don't know.
Can you see him?
Nah. I can see a couple.
Right.
There's a couple who have got their cameras on.
Oh yeah.
There's a couple.
Yeah.
Give us a wave, guys. Give
You're
us a
right.
wave.
You're right.
Stick your cameras on. Let's have a look at those who are out there.
Yeah. Yeah.
Right, we've got some teaching to do. So let's see who we can see. Hopefully you can all hear us. And if you can't, it looks like there's a couple that still can't. We are working on it. And we are going to get you sorted. For those that can, we're just going to start to talk a little slowly.
Yeah. Yeah. Absolutely.
Whilst Dave in the background sorts out our sound. Well, thank you everyone for joining us as part of Restart Heart Week this week. It's we're Kent, Surrey Sussex Air Ambulance. My name's Ben. I'm one of the paramedics here, and I'm joined by.
I'm Stu.
Yeah.
I'm one of the paramedics here too.
And the goal today is to teach as many of you as possible how to save a life. And today we're going to teach each and every one of you how to do that. We're going to teach them to be little lifesavers, Stu.
Oh, amazing! So exciting.
So hopefully we've got someone on camera. Should we have a little look on the screen and see if we can see anyone on camera? I know there's a little bit of difficulty. Oh, I can see a school there. Who have we got here on camera?
It's looking good.
Oh, so I've got a wave from, well, probably Mrs. Collins.
Ah,
But
hello,
we can't,
Mrs. Collins.
We can't say her first name.
No,
I can
okay.
never say that. Well, we definitely can't say that one. That's their first name as well. Who have we got here? We've got, oh, I can see Sky in the background of that one. We can see Sky, our mascot. And who can we see down here? What other schools have we got? We've got quite a few logging on now. Oh,
Yeah, good.
Mrs. Cooltrip, we might see her. Can we give her a wave? Lee Academy, we've got the whole academy on. Awesome, big wave from them joining. And that looks like they've got some, oh, we've got big waves from Mr. Klein's class.
Yeah.
They're absolutely waving. And Mr. Fabrace's class as well. I can see lots of people waving at the back. I can see a teddy flying in the background as well. Sound is a bit sketchy, we're being told, but we are working on it. Mrs. Burns' class are there as well. We can see them on camera. There's quite a few. We are working on the sound in the background. But I think it's time for us to start, isn't it? Let me mute my laptop. So we're going to show them a couple of things today, aren't they? We've got 5 things to show them.
Yeah.
We're going to show them, number 1, how to check for dangers and
Yeah.
someone's level of responsiveness.
Yeah, check the plate. Really important.
Check for dangers, most important step. Number 2, we're going to show people how to call 999.
Yeah.
We've got a special person that we're going to hand over
Yes.
to, and she might not even know it. Number 3, we're going to show you meet one of our dispatchers and also one of our pilots. They're going to show you exactly how our teams work.
Pilot.
And number 4, we're going to show you how to do CPR, how to do chest compressions, and how these little lifesavers could save a life, Stu. And finally, we're going to get the electricity out. We are going to show them how to shock someone's heart back into a normal rhythm.
Proper shock.
Proper shock. And
Proper
we know, don't we?
shock.
When we first started this, people used to think we wouldn't be able to teach children, and we can. They're probably better than adults,
Yeah,
aren't they?
absolutely. Really, really good.
So, are you ready?
We are ready.
Are you guys ready? Well, they don't
hear
look
me.
that
Can you hear me?
ready. Well, they can't hear us either. That's part of the problem.
Well, that is part of the problem.
But are you ready? Let's have a big wave. Teddy's in the air. Are you ready? Yeah, they look ready.
Yeah, good, good.
Well, before we show them the first video of one of our former patients, Paul,
Yeah.
who's helping us today, we need to tell them 3 rules,
Yeah.
don't we? Stu, tell everyone about rule number 1.
Rule number 1, dangers.
Yes. Always keep your eyes peeled, isn't it? They could be
Always.
anywhere.
All over the place. Got to be very, very careful.
Now, we're really lucky. Rule number 2 allows us to break the school rules a little bit, just a little. But what we do is when we're saving lives, it's all right to use our loud voices. So for today, for the next half an hour, you can shout as loud as you can and want to. And shall we tell them about rule number 3?
Yeah. Rule number 3. Rule number 3, it's got to share your knowledge. What you learn today, you need to share with other people. Your mum and dad, anybody you know, share this knowledge. It's really, really important.
Yeah, awesome. So tell everyone, and we've got special sessions this evening where the children can go home and do the session again with their adults and show them what they've learned at school. So your teachers will be able to tell you how to join those, and you can go home and show all your adults at home.
Be really proud of what you do.
So the first thing we're going to do, we're going to show you a video, which is from Paul, who's one of our patients who survived his cardiac arrest because of lifesavers, just like you.
Hi, my name's Paul Maycock. My wife had gone up to her mother's and I decided that as it was a nice afternoon, I'd put my gear on and go out for a bike ride. I was on my way back when I had my cardiac arrest, came off the bike, hit my head on the road. I had a helmet on naturally, which obviously helped to save my life. I was fortunate enough to have people following me who recognised exactly what had happened and started to perform CPR on me.
So when the call came in, the initial information that we were given was this was a cyclist who had been found unconscious. Once we got to scene, we understood that Paul had a heartbeat back after being shocked with a defibrillator a number of times. We took Paul up the road to the helicopter and then we flew him to London, which was the closest appropriate centre.
Paul is a clear example of all elements of the chain of survival in action. His recovery is testament to the bike. Not on the screen. Come back to us, we'll just run with it. That's all right. Ah, the back. Well.
Well.
It's a good job we're better at being lifesavers
Yes.
than we are at playing videos.
Yes.
But we're going to adapt.
Yeah, it'd be fine. We'll sort it.
We'll speak to Paul later.
Yeah, absolutely.
Shall we tell them about dangers?
Yeah.
Rule number 1.
Yeah, dangers.
Dangers. It still looks a little glitchy on our video, but hopefully we're getting back to it. So dangers are important, aren't they?
Yeah, dangers.
Now, can everyone on the screen let us know? Can they remember what rule number 1 was? Rule number 1, check for dangers. Okay.
Yeah.
And with your teachers, what we want you to do is call out some things that could be a danger. And if your teachers can put those in the chat, that would be really helpful. Yeah. We might be able to discuss some of those, mightn't we?
Yeah.
So we're experts, aren't we? We're experts on checking for danger.
Oh, yeah. Really.
Can you remember the last time you missed a danger?
Oh, no, I never miss a danger.
I never
I'm really
miss a
good.
danger.
I'm really good, actually.
Yeah.
You?
Well-
Last time you missed a danger?
Yeah, well, I never missed a danger. We've just lost our video again, I think. We'll just pause whilst we try and get the video back. And we're back. There you go. Apologies for everyone. I appreciate they're bearing with us a little bit. We're having a couple of tech difficulties, but hopefully we'll get there, won't we?
Yeah, I'm sure.
Stu, we were talking about dangers, weren't we? We were talking about how essentially we never miss a danger.
Yeah. No, we don't. You don't miss dangers.
No, and like
pretty
looking
good.
in now, dangers, I think they can come from anywhere, can't they?
That's
Yeah, someone's put here about a snake bite. I think that's a really good danger for us to think about.
snakes. Do we get snakes?
I've never seen a snake. Snakes for me, not really a danger.
But
But
there's a snake.
tripping over, yeah,
Mate, there's a snake.
yeah. Just
There's a snake.
a snake. Well, yeah, the guys did
There's
say
a
about snake as a
snake,
danger.
mate.
But there's
You know,
many
we were
other
saying we
things.
don't
Stu.
miss
We
dangers,
could
there's
think
a
about
snake.
roads. We could think about, you know,
There's a snake.
dangerous people on scene. We could think about
There's a
dangerous
snake.
animals. But actually, there's lots of other dangers beyond a snake, Stu. Now, as some of the people are saying, other things, yeah, if there's a lot of noise going on or no noise, it might be the case, then it's difficult. But yeah, it could be a slippery floor, it could be busy roads, it could be anything like that. And actually, you've got to keep your eyes peeled. What we don't want is for people to essentially just rush in and miss a danger and not see it and then get themselves in trouble.
You all right?
Yeah, all good. All good. Are you?
Yeah, no, blinding. It's
Yeah.
good.
Any other dangers that we've missed?
No, it's
Not
all
missed any.
fine. No, you're well done.
Yeah, okay. Well,
Oh,
once we've checked for dangers, the next thing you can do is that actually we need to check for a response. And checking for a response is really important because our person could just be asleep. It could just be asleep. Stand by. It could just be asleep.
oh, sorry. A bit tired. There was a danger earlier.
There's no dangers here. We don't miss dangers.
Sorry.
They could just be asleep. So what we want people to do
Okay.
is give people a good shake and a shout
Oh,
to
okay.
see what's happened.
Okay,
So,
good
can
shake.
you remember what we need to do, Stu? Shall we show them? What we want you to do is get your teddies. You're going to put your hands on the shoulders and you're going to give them a firm shake and you're going to say, "Can you hear me?" Say, "Hello.
Can you hear me?
Can you hear me?"
Can you hear me?
And if they wake up, it's great. And as little
really
lifesavers,
good.
this is where we want them
Really
to use their big voice, isn't it? We want
Yeah.
them to shout as loud as they can. But what's the other really important bit? It's around getting help, isn't it?
Yeah.
We can't do all this on our own. Now, we can see a couple of you on screen. Can you show me with your fingers the number that you need to call? It's the same number 3 times, isn't it? It's 999. And when you call 999, you're going to speak to some really special people. And we're going to pass you over to one of them, hopefully. And that's Carol, who's one of our dispatchers who works in the control room. And she's going to give you some tips and tricks around calling 999.
Hello, my name's Carol. I am a dispatcher for the Air Ambulance Kent, Surrey and Sussex. Today, as a little lifesaver, I'm going to tell you how you can call and stay calm in an emergency. So firstly, you need to speak clearly. If possible, call from a landline. If you don't know your address, who can you go to? So we're going to pause for 10 seconds. Okay, so you can either go to a neighbour, you can go to your teacher, or you can shout for help. So once you know your address, what are the first 2 questions the call taker will ask you? So they will ask, is the patient conscious and is the patient breathing? Okay, the call taker will then tell you how to do CPR and when to open the door. Once you've opened the door, you go straight back to the person. Afterwards, you don't stop the CPR until the ambulance crew arrive and take over from you. So also you need to think of the risks. Is there a second person available? Can they wave the ambulance crew down? So just a short recap. You will be asked, is the patient conscious and is the patient breathing? You need to know your address and who you can ask for help if you don't know your address. Open the door when you are told to. Have someone meet and wave down the ambulance crew. And if you can, put away any family pets.
Lovely, welcome back. Welcome back.
Hello.
Hopefully you can hear us a little bit better. We've changed some stuff with the audio and hopefully that's coming through a little bit better.
Yes.
But Carol gave us a couple of tips, didn't she?
Yeah.
So Carol's one of our dispatchers that sends the helicopters
We love Carol.
out, as we do. She picks out those jobs and sends the team out to go find these patients. Now she gave us a couple of tips, didn't she,
Yeah.
Stu? What were your favourite ones? She gave us some really good ones, didn't
Yeah, knowing your address, really important. Even the postcode, massively important.
she? Yeah, perfect. And thinking of people that you could speak to, you know, maybe you could go speak to your neighbours, go next door, knock on the door. There's lots of people out there that can help you, isn't there? Maybe speak to your mum and dad about it.
Yeah.
Or the adult at home and whoever can, you know, thinking about who could help you if you had to call 999. So now that they've called 999, Carol could be sending our helicopter to go speak to them. Yeah. But can you fly it?
No,
No, I can't fly it. We have special pilots who fly our helicopters. So out there, put your hands up if you like helicopters. Yeah, us too.
Yeah.
Shall we show them?
Yeah.
Yeah.
This could be you
One day.
one day.
Hello everyone, I'm Suji, I'm one of the pilots here at KSS and I'm here to tell you a little bit of information about the helicopter that you can see behind me. It's an Augusta Western 169. It's a very fast, very sleek helicopter and it allows us to get to everywhere that we cover in Kent, Surrey and Sussex within 30 minutes. We travel at about 170 miles per hour, which is very fast. It's a lot faster than your parents' car. And it allows us to get our doctor and our paramedic to our patient as fast as possible, which gives them the best chance in whatever situation that they have happened to get themselves into. So this is the inside of our aircraft. The Augusta Western 169 has a large cabin space which allows us to take both our doctor, paramedic, our patient who's critically injured and potentially a parent with us to hospital. We have this very large stretcher that the patient will be arriving from the scene with our doctor and paramedic. They slide in over the top of here. They then get hooked up onto a ventilator and a monitor system, as you can see in the background. We then push this in, rotate it in and slide the passenger into the centre of the aircraft with all the straps on. We get our doctor and our paramedic on board and then we take off and take them to hospital as fast as we possibly can. As you can see, it may look relatively small from the outside, but it is one of the largest ones that is around in the air ambulance industry, and it works very well for us. It's a heavy helicopter, but we are able to still travel at that 170 miles an hour. It nearly weighs the same as a bus, so it's quite interesting going from point to point with such a large helicopter. When we are on a call, we use an alpha call sign instead of blue lights because that gives us priority with air traffic control so that we can go from one place to another as fast as possible. That then allows us to get to the patient and deliver our crew to them as soon as we can. Once we finish that, we are able to potentially go on to a second job with the amount of fuel that we carry, up to 2 hours worth of fuel. So once we've done that, and then we have to go back to base and then refuel and then hopefully wait for another task to go and help somebody else.
Right, well, welcome back.
Welcome back.
Hopefully you can hear us. We appreciate you bearing with us. We've stuck the pre-recorded sessions in, and we've also got the link to another live stream later in the day. I appreciate you put loads of trust in us to deliver a session, and it's not quite coming together, but we're working hard. I know some of you can hear us, some of you can't. But Stu, should we recap what we've done so far? We've done a couple of things, haven't we? We've checked for danger.
We've done that. Danger, really important.
And there was no dangers at all.
Nothing, didn't see anything.
We've checked for response.
We have shake and shout.
And checked that they weren't sleeping as well.
Yeah. Don't want to fall
one's-
asleep.
We spoke to Carol, one of our dispatchers, and she's given us some tips around calling 999.
Yeah.
And then we've just spoke to Suji, one of our pilots, who showed you the helicopter and shows us how his amazing skills allow us to get to patients fast.
Yeah.
But now we need their help, don't we? Every
Your help.
single little lifesaver out there. We know that if someone's heart's not beating properly, we need to help you to help the person before the ambulance or our teams arrive. Now, can we remember the 2 questions that Carol said the call handler would ask us?
I wonder if they know.
Yeah, can we remember, guys? Number 1, is the person awake? And number 2, are they breathing normally? Now, we've already shown people how to tell if they're awake, haven't we? We give them that shake and shout. But how do we tell if someone's breathing normally? What do we need to do? It's easy, isn't it? Easy peasy. We tilt someone's head back a little bit to open their airway. Okay, and hopefully that will have them breathing. But if they're not breathing, or there's long pauses, or they're snoring, or they're agonal breathing. Now, what's this agonal breathing that we talk about, Stu?
It's like a fish out of water.
Yeah, just looking like a fish. If their breathing's not normal, we're going to start CPR. Now, are we ready for that CPR? Now, if you've got your teddy on the desk, you can stand next to your desk. You just need a little bit of space. And then you're going to make sure there's either space on the desk or on the floor. I want you to... What are you doing?
Mouth to mouth. Just need to be ready.
No. We don't do any mouth to mouth. What is that? No. No mouth to mouth. Just chest compressions, Stu.
Oh.
We're going to do CPR. So they need some space on the desk or some space on the floor. We want you to put your hands on top of each other like this. We want you to have your arms nice and straight. You're going to kneel next to your teddy and you're going to put this bit, the heel of your hand, in the center of the chest, okay? And then you're going to push, okay? Now, as little lifesavers, you're going to push as hard as you can, but only 2 times a second, Stu.
Oh, that's all right.
Not too fast. A little bit fast. Yeah, 2 times a second is what we want. Now, as little lifesavers, it's really important you push as hard as you can. But for grown-ups, you're going to push about 5 to 6 centimetres, okay? Now, that looks really good. Shall we have a little look at people's CPR out here? So you carry on. Stu, you can do some work. You've not done anything really so far, have you? And let's have a look at the schools out here. You can see them. Yeah, Mrs. Smith's class, Mrs. Collins' class. There's lots of CPR going on in the background there. Wow. Look at that. Mr. Klein's class. Cool. Everyone's in sync. Wow, there is lots going on out there. Awesome. Lots of little lifesavers being trained. Okay. So let's stop for a second and we'll give them a break because this is hard work, isn't it?
Yeah.
Should we tell them about the 3 times when they can stop CPR, Stu?
Yeah. Should we do that?
Yeah, it's really easy, isn't it? So the first one's when the person wakes up.
Yeah.
If they wake up and they push you away, we can high five. We've won.
Like it.
When the emergency services are with you. So when the ambulance gets through the door and helps,
Yeah.
they will take over. And the other one, when you're too physically tired, a bit like you earlier,
Tired.
too
Sleep.
tired to carry on. So far, we've shown you how to do CPR, but now we're going to show you the complex bit. The bit that people tell us we can't teach children, but we can. We're going to show you how to use a defibrillator and how to deliver a shock. Now, some of you may have seen one of these before. Some of you may have these defibrillators in your school, but they're also in loads of other places, aren't they?
Yeah.
They're outside fire stations, they're outside libraries, they're in phone boxes. Yeah, so there's loads of them about, okay, and I bet your school has one as well.
Yeah.
And if it doesn't, we need to make sure your school gets one.
Yeah. Find out where yours is, your closest defib is.
So, if we're doing CPR, if you're doing CPR, and we'll get the children out there to do, should we get them to do CPR yet, or should we wait? Yeah, we'll get them to do some more practice.
Yeah.
So you carry on your CPR, and whilst we're doing that, Stu's going to do some CPR with you, and I'm going to show you how easy it is to use this defibrillator. So Stu's doing his CPR, and luckily I've gone and got the defibrillator. I've turned it on by pressing this big green button, and I'm going to follow the instructions.
Medical services now.
So we're calling 999, just like Carol told us to.
Follow the voice prompt calmly.
Follow the instructions.
Remove all clothing from chest and
Remove all clothing from the street. No, they're all the patient's clothing, not yours.
Take out the pads from the bottom of the device.
Take out the pads
Tear open the
and
pads.
open them up. And you've got 2 pads, a number 1 and a number 2. It doesn't matter which way round you put these, okay?
Closely at the picture.
The
on each
pictures
pad.
are going to show you where to put them, okay? So we're going to follow the picture,
Labeled 1.
and we're going to stick
And
1
stick to the bare
up
skin
here.
of the patient, exactly as shown in the
And then the second one, we're going to put underneath the left armpit, okay?
pad labeled
Now,
2.
as soon as the pads are on, the machine will identify it, okay? And when it identifies it, it will start to analyse, all right?
Press the pads firmly to the
So,
do not
we can hear it start to do it. It says, don't touch, so Stu,
analysing heart
we need to
rhythm.
let it analyse. Now, we need to see everyone out here take their hands off. It's going to deliver a shock, so everyone, hands up.
Stand clear.
Is everyone clear?
Flashing
Let's quickly
orange
check the
button
cameras.
now.
Yeah, everyone clear, everyone clear.
Everyone's clear. We're going to deliver the shock.
Shock delivered.
Right, back with your CPR now. Back on the chest. Good work, Stu. And everyone out there, back on your CPR. Look at that. They're all going. There's proper lifesavers out there, Stu.
Incredible, brilliant.
Analysing.
Right,
System shutting
so I'm going to turn this off. I'm going to take these pads off. And shall we do a run through from start to finish
Yeah.
so everyone can see what we've talked about? Yeah?
Yeah.
Right. So, here we go. This is our Teddy.
Yes.
And they've collapsed.
Yeah.
We need to save a life.
Yes.
What was the first one we checked for? We checked for
Dangers.
dangers. Is there any dangers? There's been no dangers all day, has
No,
there?
it's been absolutely fine.
So we know it's safe. The
Yeah.
next thing is response.
Yeah.
Join along with us, kids. Say, I want you to give your Teddies a little shake and a shout.
Can
Just
you
like
hear me?
Teddy's doing.
Can you hear me? Hello.
See them doing it out there.
Hello. Can you hear me?
They're not responding. So what's the next thing that we need to do? We need to check their
Airway.
airway and breathing.
Breathing.
We're going to open their airway and we're going to see if they're breathing normally. Remember what Carol told us? Are they awake? Are they breathing? So we've opened his airway and this little man's not taking any breaths.
No.
What do we
No
need to do, Stu?
We need to start thinking about CPR.
Yeah, so we've got some help on the way and it's time for CPR and that's exactly what we want you to do. So hands on top of each other, arms nice and straight, and you're going to push in the centre of the chest 2 times a second. Let's see you all out there doing it. Awesome. There's great CPR going on out there, Stu. Right, luckily I've arrived with a defib, all right? If you could keep your clothes on this time, that would be perfect. So I've got my machine.
Call emergency medical services now.
We've already called, we're ahead. We're going to get our pads exactly as it says on the fin, and we're going to start to follow these instructions, okay?
Remove all clothing from chest and stomach.
Patient's clothing.
This clothing is necessary. Take out the pads from the bottom of the device. Tear open the pads packaging. Look closely at
We're going to follow the pictures and we're going to stick it on the chest. So there's number 1.
the pad labeled 1.
And as soon as these pads are on, the machine is going to start to analyse.
Exactly as shown in the picture.
So pads are on and the machine is going to start to analyse.
Pad labeled 2. Do not
There you go. So don't touch. Let's see everyone. Hands up. We don't want to be touching. I'm just going to do a little check and check that everyone's
advise.
got their hands up. Yep, I can see their hands up, Stu. They all look clear.
They're all clear. Good.
Ready? Everyone clear? Shock's delivered. And back on the chest. Awesome.
Again.
There's a whole team of lifesavers out here, Stu.
Oh, it's amazing.
Now we're going to do that until the ambulance arrives. That's
Yeah.
all we have to do to be little lifesavers. Let's turn this off
Analysing heart rhythm. System shutting down.
and I'll give you a break because you've worked hard. So, I think we've done a good run through there.
Yeah.
What we're going to do, we're going to hand you over to Duncan now, who's one of our senior doctors. In fact, he's the boss, isn't he?
He is the big boss.
We've got to be on our best behaviour. So we spoke to Duncan about what we can do as an air ambulance service if you, as little lifesavers out there, help us before we arrive. So we're going to hand you over to Duncan, and then when you come back, we're going to do a quick Q&A with you all. So if you've got any questions, think about it with your teacher. You can put them in the chat, and we'll try and answer some questions before we have to go. Thank you once again for everyone who's joined us so far. Hopefully the sound settled itself out, but we're going to hand you over to Duncan now. Everyone for joining us this afternoon and essentially training to become little lifesavers with us at KSS. Now, for our final session, we're joined by Duncan, one of our doctors here at the charity, and we're going to explore a little bit around what happens now that you're little lifesavers for us, what care we can do on the basis of you helping us. So Duncan, the first question, I guess, is the really simple one. Is we're asking as many people as possible to learn CPR, but some people would say trying to teach these little lifesavers that we've got in front of us, they're too young. Do you think that's the case?
Absolutely not. So the most important bit about helping people to survive after cardiac arrest is early CPR and early defibrillation, and anyone can do that. It doesn't matter whether you're 7 or you're 70. Everyone can play a part in saving a life.
Yeah, I couldn't agree more. And we saw this last year, didn't we? When we did the training, we saw thousands of children get involved. Now, in terms of what we're doing as a charity and building upon the work that they're going to hopefully do to help support us, we're in the early phases of exploring something called ECMO. Now, we all know this is quite a complex thing, but could you try and explain that for the children and what that would mean?
Yeah, so ECMO is a technology, is a machine that works to support or to replace the heart as a pump. And the machines now are small enough that we can take them on the helicopter with us. And so we're looking at and exploring, can we take that machine with our crew to the patients to try and really increase the number of people who survive from cardiac arrest?
And this could be absolutely transformational for us, couldn't it? We could save even more lives.
Yeah, so it's a really exciting technology. It comes with an awful lot of work for us to think about how we might make this work for the communities that we serve. But certainly there seems to be potential that we might be able to save even more lives with it. So yes, very, very exciting.
And the final things, that the little lifesavers, they've been learning about the chain of survival. And we've talked about the third step on that, early defibrillation. And we're starting to explore the use of drones, aren't we? How are we doing that, and how does that link to the chain of survival?
So like we were talking about, the most important piece in helping people survive from cardiac arrest is early CPR and early defibrillation. And we know that most people who have their cardiac arrest have it in their own homes or in public places, and so they're often not close to a defibrillator. And what we're doing is we're looking at ways that we might be able to get a defibrillator to those patients, to the public as quickly as we can, even more quickly than if we were to take it by the helicopter. One route that we might do that is through the use of drones. Again, it's complex in how you actually make that work, but we're looking at all the ways that we can do to try and get the defibrillators to the patients.
It's awesome. I think there's some really exciting work for people who have a cardiac arrest in the southeast, and with our work and our communities, where I think we will save even more lives. I think the last thing to say is just a thank you for joining us today. We're going to leave you with our next steps, and if you want to be involved with our charity and support us in the future, there'll be some links for you to follow. Lovely, welcome back.
Welcome back.
Welcome back. We've got a group of lifesavers up here, I haven't missed you.
Yeah, incredible. Done really, really well. Well done.
Stu, Snake.
My mate's a friend now,
Never miss a danger.
but we've made friends.
Okay, all right. Right, well, we've got a couple of questions in the chat. So the first question is a really good one. It's from Year 3, St Edward's Catholic Primary School. And they said, what happens if you do CPR too fast?
Well, shall I answer that?
Yeah, do you want to?
Yeah. So if you do CPR too fast, your heart doesn't fill with blood, which is really important, and therefore you're not pumping the blood around the system because it doesn't fill. So you have to do it slowly and allow that blood to fill in the heart, and then it gets pushed around the system again. So if you do it too fast, it won't work.
But will the children get in trouble if they do it too fast?
No.
And is it better to do it too fast than not at all?
Yeah,
Definitely.
Yeah.
So don't worry. I think it's good to do it 2 times a second, isn't it?
Yeah.
But if they get it wrong, they're never going to get in trouble. And actually, doing nothing is probably worse than getting it wrong. What else have we got in the chat? So we've got what happens if you call 911 instead of 999?
That's a good question. I'm not sure I know the answer to that.
Well, we spoke with Carol, and Carol tells us if you phone 911 or 112, it would all put you through to the same number, 999. So if you've got an American tendency, you can just dial that number and it will still get you through to the right people. Might not be Carol that answers, it might be a Dale. But the people at the control room will help you.
We love Carol.
Someone said, can you do CPR on a pet? That's a good question, isn't it?
That's a good question.
So you can do CPR on pets, but you should only do it when the pet needs CPR.
Yeah.
And I guess that's tricky to tell, isn't it?
Yeah.
But I know that there's vets out there who do CPR, but the principles just apply, don't they? The exact same principles of trying to beat the heart to move blood around the body.
Yeah.
Is exactly the same. But I was having a think, how would you do CPR on a giraffe?
You need to be really fit because you have to go. Well, you're not doing mouth to mouth, so you don't have to run up the mouth end, do you?
But you'd have to open his airway.
But you would have to open his airway. Then you have to run down, get to the chest.
Yeah.
And then if the airway closes, you have to run all the way back again.
It's interesting.
So that's you've got to have a lot of running.
What about an elephant, Stu? What would you do with an elephant?
Step ladder.
Step ladder.
Step ladder. Definitely need a step ladder.
Great answer.
For an elephant.
Perfect. What else have we got? Someone said about songs, didn't they?
Yeah.
Yeah, we try not to sing, don't we? Because we don't want to put people off. But you can. There's lots of songs, isn't there? There's Baby Shark.
Yeah.
There's Nelly the Elephant.
Baby Shark. Oh, don't know about Baby Shark. Nelly the Elephant.
Nelly the Elephant. There's some ones by Queen, but they're not.
Yeah.
They're probably a bit too old for the children.
Yeah.
But you can do ones by Queen. Someone said, when was CPR invented?
Ooh.
That's a tricky one, isn't it?
That is a tricky one.
I think we should set people some homework.
Yeah.
Because that's what teachers do when they don't know the answer.
Yeah.
They give it to everyone as a research.
Yeah, that'd be great. Go and find out.
We're going to give you that as your project.
But
So come in tomorrow at school, when was CPR invented? And if people could tell us on social media as well, and hashtag our Restart Heart Day, that would be awesome. And we can tell everyone else.
And there was some interesting early ways of doing CPR. Very, very interesting.
Yeah, there was one more question that I saw. Two more. Someone said, what's the difference between chest compressions and breathing into them? Well, they're trying to accomplish 2 different things.
Yeah, absolutely.
So our chest compressions are for beating the heart or forcing blood out of the heart and moving it around the body, whereas breathing gets oxygen into the lungs. But we know, don't we, that people get put off doing it if they've got to do mouth to mouth.
Yeah.
So now we tell people to just do chest compressions because that's better than doing nothing at all.
Yeah.
And we know that there's a bit of oxygen in your blood already.
Yeah.
That will hopefully last until the ambulance crews come. And when the ambulance crews come, they've got special machines, haven't they?
Yeah.
Bits of kit that allow them to breathe for someone. And I think the final question I saw on the screen was around doing CPR on older people. And we've got one last one around the defib after that. So we'll do those last 2.
Yeah.
So we've got one around doing CPR on older people. Do you need to press harder? Do you need to press a little bit less? I think for our little lifesavers, they need to press as hard as they can, don't they?
Exactly the same.
Yeah.
Don't try and change it. Do exactly the same.
Yeah. We know that those guidelines are there for everyone, aren't they? And they're really, the guidelines are written for all of our little lifesavers out there, aren't they? People with very little training to just be confident to do something. Really good final question. We'll come to this one last, and then what we'll try and do is you can stay on the chat and we'll just fire through some questions on the chat afterwards. But the final one is, what if you use your defib twice and it still doesn't work? That's a really good question.
It is a good question.
So the defib doesn't always work. In fact, it doesn't always advise you to shock, does it?
That's very true.
So sometimes your heart's in a rhythm that needs a shock, and sometimes it's not. And basically, I think our advice has got to be follow the instructions. And if it doesn't work, just carry on until the emergency services arrive. Because when it doesn't work, these are really tricky cases for us, aren't they? Let alone our little lifesavers. So what we want you to do is call for some help, do your CPR, and use your defib, and follow the instructions on it. Sometimes it will tell you to shock, sometimes it will tell you not to shock, and it might tell you not to shock because you've restarted the heart.
Yeah.
This won't know whether you've restarted it, but it will never let you shock someone with a pulse. That's probably a really important thing to say, isn't it?
Yes.
That actually, if you've got a pulse, it won't let you shock them. So you can't hurt anyone with these defibs. They're designed to be used by anybody.
And if it doesn't let you shock, that doesn't mean you're doing anything wrong. You are doing the right thing by doing chest compressions. So don't feel you're doing anything wrong if it says it doesn't shock.
Right, we're going to wrap up here. We've still got some questions coming in. I appreciate we haven't got through them all, but we've overrun by 12 minutes. We've taken 12 minutes extra of their learning time.
Yeah.
We've got to thank you. We've got to thank you for bearing with us through some of the tech issues and sticking with us. It's tricky, but we think we've got the answers, and hopefully you'll come back and join us. We're going to do this again next year and the year after and the year after that, because that's what our crews do. They constantly train. We want you to go home and tell your adults at home about it, and we want you to show as many people as possible. Yeah, and maybe, you know, we land our helicopters in schools sometimes.
Yeah,
don't
we do.
Maybe we'll land in your school on the way to a job one time. We may see you at some point. But thank you so much for joining us. Thank you for bringing your teddies and getting really involved. We're going to let you go and get on with the rest of your day. But from everyone here at Surrey Sussex Air Ambulance, thank you very much. Bye-bye.